Hello everyone. I'd like to show you a technique that I use when I come across a heminucleus that does not want to rotate. When you come across a scenario like that, it is tempting to push the heminucleus and push the heminucleus so that it can rotate just the way you want it to. But when a heminucleus or a fragment does not want to rotate, usually that might be a sign of weak zonules. So what I do is this swipe maneuver, where basically the entire technique is entirely on position one. I use the chopper to wrap around the heminucleus so that the chopper is now underneath the heminucleus, and I will prolapse it up into the central safe zone. Again, this is entirely all on position one. No vacuum and no ultrasound and no phacoemulsification. Now, when we stay on position one, I consider this a very safe environment because the posterior capsule is tented way back. Anytime we use aspiration or vacuum, the posterior capsule can come up and engage the chopper or the phaco handpiece. So once I've wrapped the chopper around the heminucleus and bring it up to the central safe zone, I then use mechanical forces where the chopper will come up from underneath and the phaco handpiece will come up from above in a vertical, kind of like in a vertical line, and break the heminucleus into two pieces, again with no ultrasound. This whole procedure is done entirely on position one. So it's safe because there's no vacuum or aspiration, so the posterior capsule is tented back the entire time. And it's also efficient because there's no energy. And in this specific video, it's a fairly dense cataract, and we can break it up again and again entirely with mechanical forces. So I hope you find this swipe maneuver useful, especially in non-rotating heminuclei or fragments, and thanks for your attention.